Hello, good evening. Thank you for joining us this evening. We're going to hear Dr. Michael Waters speak on overactive bladder, as well as some therapies that can help you with the bladder and bowel control. Dr. Michael Waters comes from the Alabama coastal region, where he practiced for 15 years. He graduated as president of his class at Michigan State University College of Osteopathic Medicine in 1993 and completed a general and urological surgery residency at Michigan State University, where he served as chief resident for 2 years. Dr. Waters is board recertified in urologic surgery by the American Osteopathic Board of Surgery. He was a clinical faculty member of the Alabama College of Osteopathic Medicine for 4 years and served as a clinical faculty member for Michigan State University for 6 years. He and his wife, Michelle, a graduate of Central Michigan University, have 2 children. They live here in West Fort Worth, and he loves treating and helping patients with incontinence. Tonight, he will be speaking on bladder and bowel incontinence concerns, as well as a therapy called InterStim that helps to treat those. My name is Glenn. I work for Medtronic, and that's the company that developed this therapy. You may not know the name Medtronic, but you probably do know somebody who's had a pacemaker, and that's what we're most known for. So without further ado, I'm going to pass the mic to Dr. Waters so that you can hear more about this. But before I do, I wanted to remind everyone that your phones are already muted, so don't worry about background noise. If you have a question, please feel free to type it in the Q&A box at the lower portion of your screen. All the names will remain anonymous, and we'll answer these questions during the process at the end. So like I said, I'm going to pass the mic to Dr. Waters, and I'm going to give you a quick 1 or 2 minutes here to complete a poll. So just give me a second to launch that. All right, I'll give it just another few seconds here, and then I'll end the poll. All right. All right, Dr. Waters.
All right. Very good. Well, everyone, thank you for coming out tonight. I really appreciate taking your time this evening to go over something I think is very important, but actually very exciting in medicine at this point. I just give you a little background. At Michigan State University, I wind up working with a lot of researchers in pelvic pain disorder, and that led me to work with patients with urinary incontinence. And to me, it's a very important matter. I think it's a very intimate problem to have. We don't see patients really talking about bowel or bladder incontinence and bladder issues on a routine basis. So I just want to go over a couple of things with you this evening and give you and show you what's new with bladder control and bowel control. So a lot of patients will ask themselves, well, will I ever regain control of the bladder? Many patients' lives are interrupted from their bladder problems or bowel problems. I find a lot of patients, when they enter into a public building, such as a restaurant or at a store, they tend to the first thing they look for is the bathroom. They want to know where the bathroom is going to be so they don't have any accidents. Patients ask, I see a lot of individuals whose social lives are curtailed because they don't want to date somebody. Some patients, I've actually had patients who were shut-ins for years. I had one lady who was shut in for about 25 years because of her bladder problems, and I finally got that taken care of. So, really, it's It's really a time for a change. We have some a new paradigm in medicine and for treating bladder and bowel issues, and I want to go over that with you tonight. So, really, bladder and bowel issues are not inevitable. People think they are. Like I have relatives that said, "Well, I had 4 children, so I'm going to leak." No, that's not true. Okay. And does any of this sound familiar to you? Urinating more than 8 times a day, that's abnormal. Getting the sense of urgency right off. If I don't go right now, I'm going to, wet my pants or have wet their pants. And like I said, planning activities around the bathroom, actually having to scope out public places to make sure that you don't have an accident. So you're really not alone. If you're somebody that's experiencing this type of thing, there's a large number of people who really don't seek treatment. And it affects people of all ages. And if you ignore the problem with bowel and bladder leakage, this can affect your activities of daily living and long-term performance, even at work. Patients have loss of confidence. They have loss of self-esteem. They can have poor feelings of general health. And the interesting thing is only about 1 in 6 bladder control patients ever seek help. There's a huge number of people out there that don't seek help, but I think now there's opportunities like online here and on webinars where, like I said, it's a very intimate problem, and you need to find the right doctor that can address that. So I just want to show you a brief video here. This gives you a good example of how this type of therapy can help you. Hello, folks. Well, we're having some technical problems with that video. We have another one for you as well, but I just want to continue to move on here. So the good news is, I'm kind of emphasizing here, is that bladder and bowel treatments can get you back to more freedom, more life, more control. And I think it's a very important thing to address this with my patients. So what causes bladder and bowel control issues? What causes these problems? Well, some of it has to do with what we do, our daily habits, including some of the things that we eat and drink. For example, people are unaware sometimes that iced tea is not water. Iced tea is actually quite stimulating to the bladder and irritating. And iced tea is a big factor in my practice for patients with urinary frequency and urgency and sometimes urgent incontinence. There's also certain types of foods that can cause constipation, diarrhea, or just generally irritating to the bladder as well. There's medications you could take that can actually cause problems and contribute to bladder control issues. How about pregnancy, childbirth, and certain types of injuries, such as injury or pelvic floor injury during childbirth, car accidents, anything like that can actually contribute to patients' leakage issues. So how does the bladder control work? It's actually pretty interesting. It's very yin and yang, so to speak, because we have 2 sets of nerves going all the time. One set of nerves tells our bowel or bladder to hold back. The other set of nerves, when activated, tells our bladder to go and to function, and for the bowel to function. So, bladder-brain communication and the connection is essential for good bladder and bowel control. The communication breakdown of that circuit causes bladder and bowel controls quite frequently. So unlike conventional treatments, the Medtronic Bladder Control Therapy will gently stimulate and subliminally stimulate sacral nerves in your pelvic area that controls your bladder and your bowel. So How does bowel control work? Bowel and brain communication is essential for bowel control. Communication breakdowns could cause bowel control as well. And we're talking about people who have stroke, multiple sclerosis, car accidents, spinal injuries, anything like this can actually interrupt the connection between the brain and the bowel, or the brain and the bladder. Diabetes also, notwithstanding, will do that over time. So 3 common bladder control problems that I see as a urologist. Number 1 is stress incontinence, which we've usually in the past, years ago, when we talked about incontinence, most of the time they talked about stress incontinence, okay? Grandmother leaked all the time. She had 6 babies. She leaked all the time. Stress incontinence is typically related to the valve at the bottom of the bladder. And when that valve becomes faulty, that's when it's easy for patients to lose their urine. However, there's other problems like urinary retention. So patients will come to me and will find out that they're unable to empty their bladder. They feel as though they may empty their bladder at times, but when you really examine and find out, they're not emptying nearly what they need to, and they're getting damaged or developing damage to the bladder. And then number 3, we have overactive bladder, which is where the bladder over time, due to multiple reasons. It could be from aging, it could be from diabetes, any other things. Patients can develop a very frequency avoiding more than 8 times per day, frequency at night, urinating more than 2, 3, 4, 5 times at night. And this can also be controlled with our new methods. So just getting back, what is stress incontinence? You can see that on the blue dot. Any little thing that can trigger a leak drives me crazy. That's something that patients come to me about. Sometimes it's not very bad. It's just enough when it's like, I have to wear pads now. But stress incontinence is the type where you actually have leaking with sneezing, coughing. It's not necessarily always a sensation. It just occurs. But at the same time, overactive bladder, as you can see, can lead to urge incontinence, where you actually, start urinating before you go to the bathroom, before you reach the commode. Frequent leaks, even after drinking a small amount of fluids. And some patients also develop urinary frequency, which includes frequent uncontrollable urge to go. Like I said, urinating more than 8 times per day and feeling like a sensation like your bladder's never really empty. How about fecal incontinence? What is fecal incontinence? Well, again, a very intimate thing. Very rarely do patients come in or willing to talk about that, nor do they talk about it to their family members. So your fecal incontinence is a recurring condition with frequent accidents, okay? Fecal urge incontinence is inability to resist the urge to control your bowels and go at the proper time. Passive incontinence is inability to feel when you need to go. So if any of this sounds familiar, a lot of patients wind up suffering. They have to plan activities around the bathroom, and it can be quite severe for patients. They have involuntary loss of stool, very embarrassing. Stained underpants, what they call fecal smearing, can occur. Using pads or protective garments all the time, very expensive, time consuming. So this is a fairly big and problem in our society. It's not talked about much. So let's find some more control. There are many ways to treat incontinence and get back to living life. The first thing I tend to do as a physician, I'm an osteopathic physician, so I see patients on a timeline of health. I try to see what we can do just simply with lifestyle changes. I try to identify any behaviors that are contributing to patients' incontinence issues. Then if it's not satisfying for patients, then I move to oral medications. And we have some actually very good oral medications now that are safer than the past. But there's a large number of patients who wind up actually stopping their medications within a year. And so finally, we have something now, which I'm very excited about, is advanced therapies. We didn't have this 20 years ago. We now have these therapies that actually allow us to give true control to bladder issues. So if conservative treatments don't deliver what we wanted for you, as I just discussed, we want to talk about advanced therapies. And one is for first bladder control. Yes, I do Medtronic InterStim systems. It is a bladder stimulator. There's also injected medications such as Botox, which I'll discuss for bladder control. Then there's also bowel control, which is the Medtronic InterStim, like I said, will do, and other surgical options. So let's talk about Botox for a second. Yes, the Botox, basically the same Botox we talk about from plastic surgeons and patients using Botox for cosmetic purposes. Well, research has shown that Botox in the bladder actually works quite effectively and very similar to delivering Botox to the skin. I do that by using a fine telescope and a small needle and delivering Botox to the lining of the bladder. Okay. But this treatment, while it's very good and can be effective, it's only tentative. Many times patients have to come in 2, 3, or 4 times per year to have their Botox placed back into the bladder to get them control. Many patients will come to me and say, I think it's time for Botox because it's wearing off. So one study found 67% of patients discontinued treatment after their first Botox injection. In my hands, I don't quite find it that much. I don't see that much in my patients discontinuing that frequently, but many of my patients move on to a more permanent solution. So percutaneous tibial neuromodulation is a very interesting treatment that was emerged a number of years ago, and it's basically taking a very small, basically a acupuncture needle just above the ankle bone, and the patient with a small needle inserted, the bladder is stimulated via the tibial nerve as they're sitting reading a book for a half hour. The problem is that these patients have to come in routinely to get their therapy. In fact, initiation of therapy is once a week for 12 weeks. And then they have to continue with therapy after about at least once a month or every other week. Sacral neuromodulation, Medtronic InterStim. So this is a fascinating product. This is a company that came out originally years ago with the pacemaker for the heart, cardiac pacemaker. But through research, we found out that by tuning the pacemaker and the frequency, it actually can help stimulate nerves in the bladder and the sacrum, in the pelvis and down in the sacrum to facilitate better bladder control. So this will actually gently stimulate our nerves without feeling it, and it improves the communication between the bladder and the brain, or the bowel and the brain, and gives much better control. So typically this therapy is more effective than medication. The satisfaction rate for patients when they convert from meds to sacral neuromodulation is very high. Now, what we like to do is we like to do a initial test. We do a relatively easy, straightforward test to see if you're a candidate. We do these tests in the office or an outpatient surgery center. And if we find that you're a candidate, then we move on toward placing an entire unit in place. So let's talk about taking back control. As you can see, over 375,000 people worldwide have had this therapy. It's actually much higher now at this point. We do a simple test in the office or as an outpatient surgery center. Like I mentioned, placing very small leads through the skin above the sacrum using acupuncture needles. And then we just attach a small battery, which the patient wears in an outpatient setting. So you can continue with your regular activities up to 14 days before we remove these external leads. The company is really good about calling patients on a routine basis, like every evening, to find out how you're doing and make adjustments and keep track of your, not only your daily activities, but your behavior. If there's any modification we need to look at, and we detail your symptomatology at a fairly broad-based level. So over 80% of people have achieved success at 5 years with this, which is much higher than medication therapy. Here's another interesting thing too. If you're old enough and remember the days when pacemakers came onto the forefront, they found out that patients with the old systems could not have an MRI if they needed. Well, I'm pleased to report that Medtronic has now created a system that is compatible with having an MRI done. And this is important because a lot of our patients have multiple sclerosis. A lot of our patients have spinal cord injuries. I've had previous brain surgery, brain tumor, these type of things. It's very important that they are able to go and get an MRI done when their doctor needs it. So is this therapy right for you? That's kind of the question tonight. You may be a good candidate for Medtronic bladder and bowel therapy if you have significant symptoms. If you're urinating more than even 6 times per day and more than 2 times per night, if you've tried your lifestyle changes, oral medications, they've failed, and these treatments haven't really given you the relief you want and getting you back to normal, where we all started years ago, then you might want to think about looking into this and having it done. So this is a proven therapy. No questions about it. There's no more questions from the literature whether or not this works or not. It's actually very satisfying for me to place devices in patients because the satisfaction rate is so high and we get patients off of meds. So that's been an 84% satisfaction rate for use of for bladder control. There's triple the improvement rate and quality of life compared to meds. And 89% of people using this therapy, the bowel control therapy, experience long-term success. I got another video for you. We're going to skip it. Okay. So, this is a good example. Mitzi here, a patient that's got the Medtronic bowel control therapy, and her motto is, "I'm not living in the bathroom. I'm actually living my life." And this happens. This happens. I have experienced patients. I've seen patients and gotten better who literally spend several hours a day on the commode because of their problem, and they think that's normal.
I'm going to launch this.
So we're going to take a poll now, and I appreciate your participation.
And then we'll wrap up with the Q&A.
Okay. All right. I'm going to hit back. Okay. All right, folks. So here's a slide here. It just allows you to take a look at that for a second, and just want to give you an opportunity to take down any of this information here, because there's a couple ways of getting a hold of us. We do have several locations in town. One's in Burleson, and one is in Acme Brick Plaza, which is close to Clear Fork. You can see there we have our website, texascenterforurology.com, one word. And I think we're going to have a Q&A shortly. And I'd love to hear from you guys. So please speak up.
Okay, the first question, Dr. Waters, how long does InterStim therapy last?
Oh my gosh, great question. Years ago, the battery that's in the system would last maybe 5 to 10 years, but now they have very advanced systems, and we have batteries now lasting 10 to 20 years in patients, which is fantastic. But I also point out the patient, if you have a stimulator in place, it's actually relatively straightforward and easy to change out a battery in patients. It takes about 10 to 15 minutes in an outpatient surgery center. But it is nice to know that by placing this device, you can have up to 20 years of control so it's a permanent solution.
Awesome. One guest would like to know, if I have bowel and bladder issues, can one surgery take care of both?
Actually, yes. If somebody is having, I have a lot of patients who have urge incontinence and will have chronic constipation. Believe it or not, this device is so great. There's 7 channels. We can actually tweak it and change it so we can actually get patients' constipation resolved and at the same time control their bladder. We just find out what the sweet spot is and what works best for them. Or you can have patients with chronic constipation and urinary retention. I mean, some of my happiest patients in the practice are people that find out they can't empty their bladder. There's really nothing out there for patients when they can't empty their bladder. Medtronic is the first choice to make that bladder or the bowel function again.
Okay, someone would like to know, Will the actual device protrude from my skin? Is it visible?
Right, great question. No, this is actually buried under the skin. Most of the time, you might feel a little ridge with this little, silver dollar underneath the skin below the belt. It goes below the belt, and it's under the skin, and you can feel it, but nothing protrudes out. There's nothing that's unsightly. Nobody can really tell. You can't see it when you're wearing, slacks and jeans. It's really not a problem.
Okay, does insurance cover this?
Yes, insurance is covering this. Insurance loves this. Medicare, CMS loves the InterStim generator. Why? Because in the long-term studies, comparing patients taking medications, diapers, doctor visits, urinary tract infections, all the accoutrement, all that goes with that, they're finding that the use of the InterStim is eliminating that and markedly reducing the cost of taking care of patients with bladder and bowel problems. So the government looks at it as a long-term solution, a permanent solution in getting patients off all the other very expensive choices.
My neighbor Teresa and my Aunt Karen have had an InterStim. What are the type of comments you hear from your patients after this surgery?
Most of my patients wind up are a lot of them are quite surprised. However, by doing the initial test, which is not the permanent test, which doesn't give you the absolute 100% best results, we're really screening patients to find out which patients it will work on. But the satisfaction rate with patients is really high. It gives me great pleasure and satisfaction putting these in patients because we set them on their way, and it saves them money. It saves them time at the pharmacy, sitting in the doctor's office, getting prescription renewals, any additional testing that has to be done. So for me, the patient satisfaction rate is very high, and it's one of the reasons why I recommend it. And I really enjoy doing this for patients.
Outstanding. There's one more question. It says,
Yeah.
how long does the test take? It seems so easy. Would you say that it's easy?
The initial test, is that what they're asking?
Yes.
Initial test, what we call the P&E that we can do in the office, really takes only about 10 to 15 minutes. We locally anesthetize the skin just above the fanny and above the butt, and we use these acupuncture needles, and it allows us to put little threads and little leads where we need to put them and attach it to a battery pack. And most patients, it takes about anywhere between 10 to 20 minutes to do that. It comes out very easily. You come back to the office 4 days, 5 days later, and it's simply just peeling off a dressing, and these leads basically fall out of the skin. So it's a pretty straightforward, pretty non-invasive test to find out whether or not, one, you're a candidate for it, and number two, whether or not the insurance will even pay for it.
Okay, we had one more question come in.
Yes.
Actually two. Number one, I leak a lot and go through a lot of pads. Do most of your patients get to stop wearing pads?
Yes, most of my patients, nearly all of them, stop wearing pads, particularly if they have urge incontinence, they get the really bad urgency that they start leaking, they're wearing diapers, or they're wetting the bed at night, enuresis. This is a great therapy, long-term permanent solution to make it so that patients literally can sleep without waking up with a wet bed or wetting their pants on a routine basis.
Okay, last question.
Yes, sir.
Do you feel the stimulation?
No. Oh my gosh, that's a great question. You would feel the stimulation just as much as if you put your hands up like this. Do you feel stimulation from the brain telling your muscles to move in this format and where they're placed in space? No, you really don't feel the electrical current. Same thing with the InterStim. Once we put the InterStim in, these devices the energy level and frequency is very low to the point where you really can't feel it, but it's enough for the brain to see the bladder or see the bowel and continue to control. So it's really giving back your brain's capacity to control the bowel and control the bladder again, because somehow the connection got lost along the way. And it's really a minimally invasive procedure. Typically, to do the whole system takes me about 27 minutes to put in the operating room, and it's all under the skin. It's all into the skin. There's no bowel cutting, there's no scoping or anything like that. It's very straightforward. The patients go home that day with the pacemaker, with the stimulator functioning that night. So just wrapping up here, if you want to get a hold of us, call 817-769-3370. I've actually set aside time for you patients to calling. Anyone wants to see me, I'll try to get you in soon. I've actually sent some block time in my office to get you guys in soon. Okay, I really take this as it's a personal matter. It is a intimate matter, and I take this actually very seriously. I enjoy seeing patients get better and turn their lives around. So I hope you come in to see me, and let's talk.